So it turns out there is a bridge between heartache and heartbreak. There is small but limited data to suggest a mortality benefit from meditation that rivals ACE inhibitors, statins, the best tools that we have. To further talk about this, I'd like to introduce Dr. Brahma Sharma, Associate Professor at UPMC.
Sairam, I have been overblown by this high-flowing ideas from Dr. Nanda, Mayur. Since all of you have been talking about the heart, maybe I should change the gear, and I should talk about the brain. So in this hyper-connected world, where we are trying to get connected to everybody all the time, what is happening is that we are getting disconnected from ourselves. In trying to get in touch with everybody, what is happening paradoxically or ironically is that we are getting out of touch with ourselves. And that is the saddest irony of our times. We are living in very turbulent times. And when you live in these times, that kind of dichotomy and irony, this is what happens to us. So this is the state of our mind. You may call it whatever you may: spiritual distress, existential crisis, or a burnout. So this is something people have also called age of anxiety, or maybe an age of Trump. Now the problem is, why do we suffer like this? And over the centuries, the question is not new. Actually, the question is old. And about 2,600 years ago, another young prince was also contemplating the answer to this suffering under a fig tree. It took about 42 days, and he came up with some noble truths and some path or marga. And the marga is meditation. I know it sounds like new age stuff, but meditation is the only rescue to bail us out from this mental insanity and to restore our sanity of our mind. Now, meditation is not unique. Now, we Indians from Hinduism want to claim that this is our patented thought, but meditation actually is a universal principle. If you look at the books by Andrew Newberg, he's probably the foremost authority on meditation. And he writes that meditation is actually a universal principle. In all the great traditions, Christianity, Jews, Judaism, meditation has been mentioned. And actually with the Dalai Lama and the neuroscience, there's a new science is developing called a contemplative science, neurotheology, neurodharma, and neuroenlightenment. So this is not a fad, this is the science coming back. And because of that, there's a lot of interest in modern science, and that is where I got attracted to this meditation, not only as a faith, but as a science, as a real science that can show us a roadmap to restore our sanity. Now the history of science, or history of meditation. Now in Vedic age, about 5,000 years ago, people were sitting under banyan tree and looking at the fire. But the historians kind of dismissed that experience as some kind of a pot smoking, all these hallucinating babas and gurus of the yesterday India. But when Dalai Lama and when Buddha came, it gave some authenticity, but again died down. Nobody paid attention until Vivekananda came to America almost 100 years ago, and people started looking back at the meditation, but there was no science. It was, again, something very esoteric, occult, limited to a few people who had no background, and was kind of brushed aside. Dalai Lama came to the forefront, and he became one of the four figures in the neuroscience. I don't know how many you know. I know Anil Nanda and Venkat knows that he was one of the guests in one of the neuroscience conference. He invited a lot of neuroscientists and researchers to Dharamshala. He conducted the new science where Eastern wisdom and the Western neuroscience connecting together. And that has taken over this new field of neurodharma. Of course, Mahesh Yogi, the transcendental meditation, and the Beatles kind of popularized this. And of course, the duo combination, the very powerful duo of Oprah and Chopra, kind of commercialized it. But the one person that actually deserves the credit the most for bringing meditation from the occult to the regular mainstream, from mystical and metaphysical traditions to the medical science as a mainstream, is this last guy, John Kabat-Zinn in Massachusetts. He's the one guy who has actually brought the meditation into simple mindfulness and has taken to the Google chat rooms, to the armies, to the sanitations, to the prison houses, to the medical schools, And from there on, the meditation has become so mind-boggling as a common phenomena that many people call it mindfulness. It becomes like McDonald's, a common commodity, commercialized. So there are many types of meditations, and I know we don't have time to go into those, but fundamentally meditation is the same thing. Basically, meditation means, according to the Greek definition, centering the mind, concentration, and then relaxation of the mind to a particular thing. An object, could be a song, could be a bhajan, could be namasmaranam, could be chanting. Anything can happen, but on the brain level, we'll come to that later, at a neurocircuitry and neural pathways, bottom line is the same. And out of these 10 different types of meditations, I'm going to just talk about maybe one or two. The most popular, of course, in the history was Vipassana, originally from Buddha, and that is a powerful means of self-transformation by self-observation, Vipassana. But now, in a vogue, we have two types of meditation. Of course, the mindful meditation, and the new variety of meditation that has been used very powerfully now is a compassion meditation called a metta meditation. And when we talk about mindful MD and mindful care, the metta meditation is the one that has been showing more promise and more force behind it. Metta meditation is a compassion meditation, loving kindness meditation that has been shown more data. So, how the meditation has become mindfulness because of John Kabat-Zinn. And the very basic simple definition is meditation is be here now, in the moment. And if you want to read the definition, it's paying attention in the present, on purpose, without judgment. Wherever you are, however you are, you just be in the moment and pay attention and let the thoughts come by. The thoughts will come and distract you, but let them go like the clouds in the sky. But be in the moment. That very practice of meditation is the one that is promoting, which is very secular, very scientific, and also mainstream. You don't have to go to a guru or a Himalayan caves and have a candle or an incense or a Lululemon pants. You can do it anywhere, wherever you are, whatever you're doing, just 2 minutes, 3 minutes, 5 minutes, 10 minutes. But practice requires the meditation to be successful, and this is the kind of meditation and the neuroscience I'm going to talk briefly. Now, this is the world's happiest man. I don't know how many you have read his books. He's Matthew Ricard. He is actually a molecular biologist who gave up medicine and went to become a Tibetan monk. And when the people from Wisconsin, Richard Davidson, tried to study his brain, they found that he was perhaps the happiest man in the world, because when they put the functional MRI is the MRI that can actually record the metabolism of your brain. They found his left frontal lobe, which is the site of compassion, gave so much energy, so much light, that they had never seen this. So not only on the EEG, but on the MRI machine, they were so surprised to see this a light glow. And this is because overactivation of the left frontal lobe, which is seat of compassion. He's Mr. Compassion. He's the one who's promoting this compassion meditation or metta meditation. Now, a little bit of neuroanatomy, because Brother Anil and Brother Mayur and, we're talking about too much about the heart. Let me talk about the brain. Now, the brain has different, evolutionary wisdom. We think about evolution as some kind of freak accident. No, there is wisdom in every step of evolution. The way we survive, why we survived, there is always a message and signatures in the evolution. The brain has three components. First is the reptilian brain, which is very, very instinctual brain, and then the feeling brain, the mammalian brain. But the brain that is in the forefront, the neocortex, which is 76%, is the thinking brain. And the reason I'm talking about these things is because this is how the dichotomy takes place. The constant conflict between the thinking and the feeling, the emotion and the reasoning. And we always get into trouble because of this disharmony or disease that Sister Meera was talking about. So we have become a thinking human being, but it's still because of constant conflict, we develop that stress and distress. And again, this thinking brain is the forehead, and the feeling brain, emotional brain is the hind brain. And because of back and forth, there is a constant dialogue going on and tug of war, and that causes all kind of imbalance and distress between internal and external, and we develop the stress, anxiety, and the suffering. Not only that, in the brain, there are 2 points of brain here, the right brain and the left brain. The left brain is very mathematical, nerdy type, very calculating analytical, but the right brain that we need to develop is intuition, innovation, inspiration, and a creativity. So there has to balance between these two parts of the brain and also between the brain, the hindbrain, and the forebrain. Now, as a scientist and a physician in us want to know how this all happened, how did we survive? And rather than going to the belief systems, I thought I'll talk to the science behind this. The first person who took the chart on our response to stress was Walter Cannon at Harvard. In 1920, he studied what we call the fight and the flight response. Now, this fight and flight response was present in our forefathers millions of years ago, because when we were walking on the beaches of Serengeti Plains in Africa, and the saber-toothed tigers were chasing us, this was the only thing. You are looking for the food, either you get the food or you become the food. But the problem was that this acute response was very helpful for our survival in that time. But problem today is that this acute response has become chronic. We are constantly being demonized and something is changing us all the time. We are persecuted by this stress phenomenon all the time. And that's why it becomes a chronic response, and that's very detrimental. The acute response, which was good for survival, which was saving us, now the same response has become a perpetual response, a chronic response leading to chronic inflammation, chronic disease, and is killing us. And so this response is a maladaptive response. The second person who took a shot at this, again from the Harvard, Herbert Benson, I know some sisters and brothers were talking about yesterday. He actually was not very keen to study the people, but meditation, transcendental meditation, was very popular in the 60s in the hippie cult area. And some of the students from the transcendental meditation of Maharishi went to him and he said, no, I don't want to study you. Nonetheless, he put them under scope and he found out that there is a physiological response of meditation for the first time documented in the lab in the Harvard. And of course, we'll know about that, the decrease in the blood pressure, decrease in the heart rate, and decrease in all those things, and temperature also. And this response he wrote in the book, and the book became the bestseller book, Relaxation Response. But the response that the neurotheologists or neurodharma people, the dharma people like Dalai Lama and all these neuroscientists of the new age are saying that there's another response. And that response is a mindful response. Means any situation, you don't freak out, you don't fight, you just accept. You accept the way it is. You don't react, you just respond. And we don't know the neural pathway for this. People are figuring out where this all happened. But they think this is the best response for our common age, and this is the response that Buddha taught, that accept what it is. Go with the flow. Be in the moment. Don't fight it. Just be in it and uplift the moment, because you're not going to change. Because we are not really a body phenomenon. We are a spiritual phenomenon. We are spiritual beings living in a human existence. So you do what you can do, but get with the flow. Don't fight it. So initially, the people only had EEG, and they studied all these brain waves, and I don't have time to go into this, but the more you meditate, from a gamma to the beta wave to the alpha to theta, slows down. You can see on the left side that slows down, and in between these gaps, there is a moment of space or a sacred silence, what we call, the people who read meditation practice. That sacred silence is nothing scientific. Nobody knows. Nobody can explain that. But if you go to metaphysics and mystical training, that silence is the source of intuition and innovation and thinking and connectivity and creativity. So that I cannot decipher scientifically, but that phenomenon is the one that is source of all the mystical phenomenon that you get. And the next thing is a functional MRI, which is a very scientific thing. And then the next one is the default brain. The brain that is in default mode that we all the time thinking about is a default mode, and the meditation or mindfulness of being for default to the focus mode. They found this neural pathway, why we suffer, why we ruminate, is because of default mode. And of course, they have laid down the pathway, the neural pathways of the meditation from the frontal cortex to parietal cortex, all the way to thalamus to hypothalamus, and ultimately to the hippocampus, where you get a glow, an arousal, and a bliss. And when you go back and forth, it is actually balanced between sympathetic and parasympathetic nervous system, and that will develop equanimity. Now, this is the meditation on the brain. And Sister Meera was talking about neuroplasticity. That is a phenomenal discovery that our brain cells are not dead. Actually, we can regenerate, and you can develop new wiring and new synapses. And that is a profound contribution of the meditation and mindfulness that we didn't know. But it's now medically shown that you can rewire your brain. You can lay down the neural pathways. You can sculpt your brain again. You can reduce amygdala. You can do neurosurgery without a scalpel. So this is the phenomena that I think we focus on. This is a very powerful, this is a very empowering idea behind meditation, that you can remind your brain. We all know that the brain will control your thoughts, but can the thoughts control your brain? This was not new. This is something very phenomenally profound, disruptive, that yes, you can control your brain. You can make your brain by having good thoughts. Good thoughts will lay down the pathway for a good brain. So vice versa is also true. Now, this is the most important study. I have so many studies, but because of lack of time, let me show you this. Salazar from Harvard, and she showed that by meditation, only about 10, 20 minutes, you can increase the cortical thickness. And cortical thickness is very crucial. It improves our memory, our speed of thinking, and delays dementia. So this is something you can do every day, 20 minutes, even 8 weeks, it showed the change. And then, of course, the next study is the next one is this area of the second set of pictures in your temporal lobe and the parietal lobe, where you have empathy and compassion. And the last one is the amygdala. Amygdala is the brain center where you have all the freak response, the fear monger, the fear center. And by repetitive meditation, they have shown that you can shrink the amygdala and you can calm your brain, increase empathy, increase compassion. So this is emotional regulation by meditation. And this is much better, much more long-lasting than the antidepressants. Now, this is a cardiology. Only two things I will mention briefly is this important journal, Journal of American Cardiology and Circulation. You can see that a lot of studies have shown the rhythm control, the atrial fibrillation. There's a study called Yoga My Heart. It has been shown more than the medication, mindful meditation, yoga can control your AFib and prevent relapse and recurrences. And of course, this is a study that Gopi was talking about, circulation, that in addition to lifestyle and other risk factor modification, mindful meditation in Afro-Americans and other population have shown 43% reduction in mortality. That is something very profound. You don't see many journals and articles talking about mortality reduction 48%. Now, this meditation on the telomere, it delays your aging. These chromosomes at the tip that are frying and being fossilized, meditation will rewire them and also increase the content of telomerase and will keep you going. So it will provide the anti-aging effect. This is the most profound study in the Stanford Center of Compassion where they show that meditation not only changes your brain, your heart, but it can change the very genome. It can change the genome at the DNA level, at a cellular level, by all this oxidative pathways, nitric oxide, oxytocin, and all these good hormones and good cellular markers, decrease cytokines, decrease interleukins, and nuclear kappa beta factor that is a source of inflammation and genetic expression. And this is the epigenetics I was talking to yesterday with Sister Meera, that meditation, epigenetic, human genome, which is kind of done deal, not much excitement. People are going to epigenome now. An epigenome is a mapping and constant changing of your genome with the meditation with the agouti mice, and you can change yourself. You can change yourself, reprogram yourself by good habits by meditation, and you can change your epigenome and also live longer and happily. So this is all science-based data that are corroborating with our ancient wisdom. Of course, 2 minutes. This is the state of medicine. That was the state of us. In crisis, this is state of medicine. We are actually have no meaning, no identity, no purpose. And again, the meditation not only comes to rescue as mindful MD, but also the mindful care. And this model, doctors, somebody mentioned Daniel Ofrid's, this is a bestseller book. Everybody should read this book, How Doctors Feel. This is how we feel. We're burning out. We're burning out. And one technique we can do, very simple thing, is to spend 10 minutes in the morning, 10 minutes at night, and just meditate, mindful meditation, loving meditation, whatever you do, and energize and tune up your brain so that you have compassion and empathy. This is Brother Anil showed this compassion on the left side. But this is from JAMA by an artist who's a 7-year-old who went to see a doctor, and he saw the doctor sitting behind the computer. And she painted it, and it came in JAMA. And this is what we should be, and this is what we are now, electronic MD. You're not even looking at the patient, forget about compassion. And this is the study from Michael Kreshner, JAMA, who studied the mindful meditation in helping the people who are burning out. And it has shown definitely that your outcomes are better, your litigation is lower, you have more compassion, more concentration, more empathy, and better outcomes, and better quality outcomes, same thing, well-being. And this is what we need, metta meditation for mindful MD, for mindful care. And how to meditate? Very simple. Somebody was asking in the panel discussion, where do we go? On the Dr. Martin or somebody, where do we go? Where do we find? It's very simple. Very 3 steps. If you have 2 minutes, I will beg the organizer, give me 2 minutes. Sure, and I would rather do it now. Let's sit down, practice this 2 minutes of mindful meditation so this talk is incomplete. Okay, all right. Thank you. Thank you for your attention.